Hi, this is Matthew Hansen, the managing editor of the Buffett Early Childhood Institute. I'm here today with Susan Sarver, Director of Workforce Development at the Buffett Institute. And we're going to talk today a little bit about what it's like to be a child care provider in Nebraska, in the United States right now during this time of COVID-19. Thanks for being here, Susan. This is the first of many conversations that we're going to have with leaders and experts at the Buffett Institute. Thanks for being our guinea pig.
Thanks for letting me try it out.
Okay, question one. Let's talk about something that has been designed to sort of help child care providers right now. It's the new child care referral website. It's the first time we've had this in Nebraska. What's the importance of this website for essential workers, for child care providers, and for parents moving forward?
Yeah, that's a great question. One of the first things we heard as soon as this started is parents who still had to go to work despite the directed health measures. Schools are closing, they've got school-age children. They needed places for their kids, and many child care centers were closing or reducing the capacity of kids. So we were hearing both from parents and from child care providers about this need. There was no way for them to connect together. So a group of organizations worked together and started finding out who's open, what's the capacity. And I'm going to share my screen with you here, and I'm going to show you what has come out of this. The Nebraska Child Care Referral Network is now up as a website, and a parent can go in and you can search. I've put in here my zip code, and within the 10-mile radius of my zip code, you can find providers. I have this as looking for all providers, so it will show me infant and ones who have infant and school-age children openings. You can scroll down and it'll show you the capacity, how many children they are taking by age range, and they'll give you the hours, and then it gives you the contact information for each provider. So you can go down and look and see what's available within your area. The search filters that we have managed to put together, working with Department of Health and Human Services and Nebraska Department of Education. You can also look to see if providers are accepting subsidy, if you're eligible for subsidy, and you can look for providers who are participating in Step Up to Quality, which is our state's continuous improvement program. So any provider that's participating in Step Up to Quality has made a commitment to quality in their program. And then the search will automatically update for you, and you can look again and see who has openings for those kids in the age range that you're interested in. The goal with this is to continue this website and build it out continually so that this will exist even after this pandemic is done. So it's something that was needed right away for both parents and child care providers, and it's something that can really help the state in the long run.
Yeah, it's very cool that in this moment it's something that has this obvious short-term benefit, and then it's gonna help for years to come.
We were hearing, especially from hospitals and health organizations, that a lot of their staff were struggling to find childcare because some were closing. And I'm also guessing because they've got a lot of health personnel working extra shifts. So there's an increased need for certain people for childcare at this time.
So just to ask a basic but a really important question, what is life like for Nebraska child care providers right now in the last 5 or 6 weeks? How would you sort of describe the reality of the situation as you see it in Nebraska right now?
Stressful and emotionally draining. What we have been hearing, the Buffett Institute put a survey out as soon, not long after some of the close downs started across the state, the directed health measures going out. And what providers reported then is they were stressed. They were worried about closing. A lot of them were worried that if they closed, they wouldn't be able to open back up because it would be financially unfeasible for them to be able to open back up because of the loss of money. They're worried about their health. They're worried about the families and children that they serve. They're just as worried about the families and children as they are about themselves, is one of the things that really has come through as we've talked to them and as we looked at this survey. They know there is a need for the care for these kids, but they're concerned about what the implications are of spreading this virus across families and children. They're struggling with guidelines about social distancing. You can't keep an infant 6 feet apart from you. You can't keep toddlers 6 feet apart from each other. You know, you can wash their hands over and over, but there's just some things that aren't realistic. So they've been looking for guidance. They've been looking for help. And what I can say is what I've seen from state agencies and private organizations across the state, folks are really starting to try and step up and help, sometimes in big ways, like this website going up, and sometimes it's smaller ways. I know you've done a column recently about a pharmacy that's handed out hand sanitizer for free to childcare providers. So thing like that helps them, even if it's just a little, it's one less burden that they have to think about and deal with.
Yeah, the amazing thing to me about that story and some other similar stories is that they're small examples of assistance, but you can tell that it matters, and not so much in the sense of the thing, but also in the sense that childcare providers feel seen. They feel recognized, you know, that they're important and that there are people out there trying to help. It was my sense of it.
Yes, I completely agree. I think one of the things that has really come out of this is we're talking a lot about essential workers, and healthcare workers as very essential. All those other essential workers, the men and women picking up our garbage, the people at the grocery store allowing us to go get food or delivering food to us. Childcare providers are part of that essential system. And they've always been there, but we've not always recognized it. I think one of the reasons that they're so stressed now is because they were stressed before. I mean, even before this happened, we knew most childcare providers aren't making a living wage. They're not making a lot of money. We have a lot of data that shows that. They were already under a lot of stress. And this is additional stress on top of that. So I think that is one thing that we're really seeing coming out of that, is that we're recognizing how important this is to every part of our lives. We can't go to work. I mean, if you're at home with several toddlers now, you know how hard it is to work from home with those toddlers running around. So a lot of parents are finding themselves in that position.
How do you feel that this, the essential workers thing brings up an interesting point and maybe a little bit of hope for the future, it would seem, which is if we're recognizing now as a society a little bit more that childcare providers are essential, what do you think that might mean for, a year from now, 5 years from now, 10 years from now in the state of Nebraska? Can we build a better situation in some way out of this?
Yeah, I think we can. I think it's one of the things the Buffett Institute has been working on even before this. So at the end of January, we released a report and recommendations based on a group of 40 people that had come together for the Nebraska Early Childhood Workforce Commission. And that group were thinking very deeply about what's happening in the early childhood field, what does it mean, and where do we need to go? And so we released this report, Elevating Nebraska's Early Childhood Workforce. I know it's kind of hard to see, but you can go to the Buffett Institute website and you can download it and look at the recommendations. But elevating the workforce was the goal of that report, helping people understand that this is essential for families, children, the economic vitality of the state, and that what these professionals do is a skill, and it's knowledge they have that they bring to children and families that they've learned, and it's important, and we have to support them in a lot of ways. So the recommendations in that report and other strategic plans throughout the state really give us goals. We know where to go. So as we're coming out of this, as we're doing things like building the website, making decisions about how to allocate money that is coming from the federal government and places to help, we can use those as guideposts to say, this is where we got to get to keep this to keep the system going.